Hello, I am Dr. Philips. Bringing a new baby is one of the most joyful moments a family can experience. But for many parents, especially first timers, that joy is often mixed with a bit of anxiety. You find yourself watching every breath and every movement, wondering what is normal and what is abnormal. Most of the times, babies make strange noises and have unusual patterns. However, there are specific trouble signs that act as a baby's way of saying they need medical help. Today, we are going to walk through the red flags you should look for in the first weeks of life, so you can act with confidence and clarity. We look for signs of respiratory distress such as nasal flaring. If your baby's nostrils are widening significantly every time they breathe in and out, they are working too hard to get air. Grunting. If you hear a repetitive woo or grunting sound with every exhale, is a sign of struggle. Retractions. Look at your baby's chest without their shirt. If the skin is sucking in deeply between the ribs or at the base of the throat with every breath, this is a major red flag. Color changes. If you see a bluish tint around the lips, tongue, or face, this is an emergency. It may mean that the baby is not getting enough oxygen, or it may also mean that the baby does not have enough blood. Temperature and fever. In a newborn, a fever is not just a little illness. It is something we take very seriously. If your baby is under 3 months old and has a rectal temperature of 38 degrees centigrade or higher, you must call your pediatrician or visitors immediately. A newborn's immune system is still developing, and a fever can be the only sign of serious infection. On the flip side, being too cold is also a concern. If your baby's temperature drops below 36.5 degrees centigrade and they aren't warming up, even with skin-to-skin contact, that also requires a medical attention. Jaundice and feeding issues. Many babies have a slight yellowing of the skin or the sclera of the eyes, known as jaundice, in the first few days. The yellow test. We look at the whiteness of the eyes, the area called the sclera, and the skin, particularly the chest. If the yellow color is moving down the stomach or legs, or if the baby is becoming very sleepy and difficult to wake for feeds, the jaundice level may be high. Feeding red flags. If your baby refuses 2 or more feedings in a row, or if they are so lethargic that they won't stay awake to suck, we need to check their hydration and blood sugar. Hydration check. You could see at least 6 to 8 wet diapers a day by the end of the first week. If the diapers are dry or the urine is very dark, your baby may be dehydrated. You will quickly learn your baby's normal. Lethargy. This is more than just being a sleepy baby. A lethargic baby is usually weak and limp. It's very difficult to rouse, even with a diaper change or a tickle to the feet. Inconsolable crying or continuous crying. All babies cry, but if your baby is crying with high-pitched piercing sound and cannot be calmed by rocking, feeding, or shushing for several hours, they may be in pain. Vomiting. There is a difference between speed up and projectile vomiting. If your baby is forcefully throwing up most of their feed, or if the vomit is bright green, this could indicate a blockage in the digestive system. I know this list can feel overwhelming, but remember, you are the expert on your baby. If your gut feeling tells you something is wrong, even if you can't put your finger on it, trust that your instinct. Go visit your doctor. I am Dr. Philips. We are here to keep your little ones safe and thriving.